Have you ever been in a situation where you had a great idea that you wanted to implement, and then someone asked you if you had a PIA for that? Maybe you wanted to add a new digital health app to make it easier for patients to book appointments with you, or get access to Alberta Netcare Portal, use the internet to get online consultations for your patients, or start using a new EMR. Or maybe you had a new healthcare practice and you're excited about choosing the right location, the right equipment, the right vendors that fit your budget and your goals. A PIA is an important tool that you can use to help you with your project management. It will help you anticipate the risk to the project before it starts and avoid serious problems, wasted time, and money. The PIA process requires you to have written policies and procedures that you can implement the project effectively and train your staff consistently. Sometimes a PIA is a requirement of legislation, but it is always a best practice whenever you implement a project that includes personal health information. My name is Jean Eaton, your practice management mentor with Information Managers, and your host for this 30-minute webinar on what is a PIA. When we implement a new project, it usually has lots of moving parts about who is involved and how the information is shared, and sometimes what type of technology is used. We need to assess all of the pieces to ensure that there is a legal authority to do what we intend, assess the privacy and the security risks, and minimize all of those risks. Next, we ensure that the process is efficient and includes written policies, procedures, agreements, and training. The purpose of a privacy impact assessment is to protect the personal health information during the collection, use, and disclosure of that information. We also need to consider the retention and the storage requirements. The PIA also ensures that the individuals that the information is about, in this case patients, has access to that information. The first step in the PIA process is to engage the stakeholders, those people that are involved in doing the task, and the employees, departments, vendors, and processes that support those tasks. The PIA processing also includes documenting all of these details. Then the PIA is submitted to the reviewing party who reviews the PIA and then accepts it. And then there's an annual review of that PIA process. So let's take a look at this in a little bit more detail. When you engage the stakeholders, you're going to encourage them to compare and document the information flow. How does information get collected? Who does it go to next? Who uses it and who discloses it? So it's a visual diagram of how the information is shared. You also need to have those policies and procedures to make sure that those steps are well documented and clearly understood. Then is the start about doing the documentation of the PIA. As part of that documentation, you're going to take a look at the implementation plans and identify the risks and the safeguards to ensure the privacy, confidentiality, and security of the personal information. Each step requires a legal authority. So we need to take a look at the enabling legislation. In Alberta, in healthcare, we take a look at the Health Information Act. PIPA legislation is the um, Personal Information and Protection Act includes employee and business information, and that may be part of our information flow as well. So we need to take a look at the legal authority and then actually link that correct section of that legal authority to each of the steps in the information flow and our processes in this new project. Then you need to prepare the PIA submission. So after you've gathered all of the information, it needs to be collated and organized into the PIA process so that it can be reviewed by people within your organization and sometimes to those external stakeholders. The last step in preparing that privacy impact assessment is to make sure that it is reviewed and accepted by the management team and the custodians or the CEO of the organization. Once that PIA submission is prepared and has been accepted and approved by those management parties, then it is sent to the Office of the Information and Privacy Commissioner in Alberta if your PIA involves health information. Sometimes that review process is internal. Maybe it's the head office that has to review that privacy impact assessment. There may be questions about the PIA submission, and you need to resolve and respond to those questions. Eventually, your PIA is accepted, and if you've submitted it to the Office of the Information and Privacy Commissioner, you will receive a file number, sometimes called an H number, um, that demonstrate that that PIA has been accepted by that commissioner's office. Now, many people in Alberta will ask you if your PIA has a corresponding file number or an H number, and this is the process to get there. Now, once your PIA is done, well, it's never really fully done. Each year, you need to do an annual review. If you change a process, you add new technology, or there are other things that change in your PIA, you might need to do an amendment. Sometimes an amendment is a very small thing, so it can be managed by a couple of pages of a letter. Sometimes an amendment requires the same or similar amount of effort as doing the initial privacy impact assessment. The amount and the type of the content that has changed will determine whether or not you need a PIA amendment or perhaps even a second or multiple PIAs. Large organizations will have many PIAs. Some small organization will have a few. But in healthcare in Alberta, every organization that is providing a healthcare service and has a custodian must have a privacy impact assessment. Have you ever experienced how sometimes the best laid plans can get morphed or changed over time? When you take the time to ask questions and confirm the details, you might be surprised to find out that some of the assumptions that you made about your current process did not work out the way that you thought. We often plan to do one thing, but then the circumstances change, or someone takes a shortcut, and suddenly what you planned to do is not what actually happens. So here are some examples of activities that were discovered during the data gathering phase of the PIA process that were not implemented as planned. A frequent problem that is discovered when preparing for a PIA is that there is no backup or that the backup is incomplete or not encrypted, or that authorized employees or vendors working off-site work from computers from their homes and their kids have access to it as well. Unfortunately, sometimes we find other examples of malicious activity, like when an authorized employee who has access to patient information in the electronic medical record or Netcare files posts patient information to Facebook in an attempt to shame the patient. The questions that we ask during the PIA process are important. The time that you take now to identify the potential risks and prevent those incidents from happening may save you time, money, reputation, and even jail time in the future. A regular review of your PIA can provide the structure that you need to review your processes and make sure that they are still following good privacy and security principles and are efficient business practices. So, what will a PIA do for you? A PIA can help you to select the best vendors or solutions for your practice. Will clearly document your procedures, facilitate discussion with stakeholders, and develop clear understanding of expectations of your group practice for employees and vendors. You may need a PIA for your project when it includes personal information. You may need a PIA when it is required by your professional college or by legislation. In Alberta, under the Health Information Act, the submission of your PIA to the OIPC is mandatory if you are a member of a designated regulated health profession that is named in the HIA legislation and are providing a health service. Under the Health Information Act, submission of your PIA to the OIPC is mandatory, and you must precede the implementation of your new system or practice. You need a PIA when you are opening a new clinic or establishing a new health services program. You are changing administrative procedures or technology, equipment, services, or vendors. You are changing how you collect and use personal information. You are implementing or changing an electronic medical record system. You are sharing health information with another healthcare provider or organization, primary care network, or other health program like the Alberta Netcare Portal. Or when you have a PIA that was written more than 2 years ago. It's time to review and update this. Under the Health Information Act in Alberta, the individual who is ultimately responsible to ensure that a PIA is completed is the custodian. A custodian includes these individuals that are designated under the Health Information Act: physicians, chiropractors, dental surgeons, dental mechanics, midwives, opticians, optometrists, podiatrists and osteopaths, licensed pharmacists and pharmacies, dentists and dental hygienists, registered nurses, the Health Quality Council, and Family Care Clinic as um, identified by the Minister of Health. The privacy officer in an organization is often the person that completes the privacy impact assessment with assistance from other stakeholders and the business unit. However, it is the custodian or the CEO that is responsible for the privacy impact assessment. So you've decided that you want to complete a PIA for your new project. Or perhaps you must complete a PIA to meet your regulatory or professional college requirements, or just because it's your organization's policy to complete a PIA whenever sensitive or personal information is part of the project. There are three common strategies to consider to complete the PIA. Which option you decide is best for you will depend in part on what you have more of, time or money. A consultant may be internal to your organization or external. If you are part of a large organization or association, you may have a dedicated privacy officer or project manager who will work with you and your business unit to develop the PIA. Or you may hire a consultant from an external business with experience in your industry and is knowledgeable about the regulatory requirements in your jurisdiction. Hiring a consultant takes less of your time and more of your money. A second strategy is for you to learn more about the PIA process and do it yourself. There are in-person workshops and online courses that you could take. There are online resources that you can access from the Office of the Information and Privacy Commissioner. Information Managers offers an online course. Protect your practice, your assets, and your patients with privacy impact assessments, a complete step-by-step course with online coaching from me. The DIY approach will take more of your time and less money to complete your PIA. If you are the type of person that likes policies, procedures, and details about legislation, this is a good option for you. The hybrid approach includes doing the majority of the information gathering and creating or reviewing your existing policies and procedures for your project. You also work with an experienced consultant, internal or external, to help you put the pieces of the PIA together and prepare the PIA submission, and to work with you to develop the implementation plan. This hybrid approach takes a more equal amount of both time and money. A privacy impact assessment is a practical business tool in your healthcare practice. Today, we've discussed what a PIA is, what a PIA will do for you, and when you need a PIA. I've also given you 3 strategies that you can take to complete your PIA: hiring a consultant, doing it yourself, or a hybrid model. To learn more about privacy impact assessments, or if you need assistance with your PIA, answer the survey below for more information, or go to informationmanagers.ca/PIA. Until next time, this is Jean Eaton, your practical privacy coach and practice management mentor with Information Managers.